I'm a general practitioner and I'm involved in research in a variety of areas. My general practice is particularly working with people with HIV and AIDS, and so we have research looking at ways that we can improve the primary care management of HIV. I'm also very interested in the use of new technologies in medicine, and we have research looking particularly at how we can use computers to improve the quality of care which we provide through general practice and also through hospital-based care, and also how can we use computers as a way of picking up errors which occur in clinical medicine and then use the lessons that we learn in order to make our health system safer and of a higher quality for our patients. Well, the research I'm involved in actually covers both clinical decision support and patient safety, and what we're looking at is particularly ways that we can use new technology to improve safety and quality of healthcare through the use of electronic health records, through improving the quality of prescribing, through improving preventive healthcare and health promotion at the time when people see their general practitioner or another clinician. There's lots of different ways that we can use the technology. It's a very exciting field. I'm very excited about many things in medicine and what's happening. I find the whole area of genetics and the potential impact that genetics is going to have on the individualised treatments that we'll provide to our patients in the future, its ability to allow us to work with our patients to produce an individual preventive health plan and health promotion plan for each individual person. That's very exciting. Some of the challenges that we're going to face in the counselling that people are going to require as we start to predict healthcare problems which they may encounter in the future or which may affect and have an impact on members of their families. So it's a very exciting, fast-moving area of clinical medicine. I'm also very excited about how we use new technology in medicine to make what we do safer and of a higher quality. And I've been visiting the United Kingdom recently looking at the electronic health record initiatives in the UK, and I find that really exciting for countries like Australia, where we're going to be able to follow some of the examples in the UK to improve the quality of care we provide through general practice and through our teaching hospitals. I'm also really interested in looking at how we're going to use primary care as a vehicle for addressing some of the healthcare problems of people in developing parts of the world, many of the low-income nations of the world. We're in an exciting time where HIV is starting to become treatable in many countries where that hadn't been possible before. And we've got people who are now taking antiretroviral medications. What we don't have in those countries often is strong systems of primary care to actually support those people as they move from a phase of having an inevitably terminal disease into having a disease which is going to be chronic and manageable over time. And I'm very interested to look at how we as a global community tackle these problems of ensuring that everybody in the world has access to some degree of high quality healthcare. Well, the Journal of Medical Case Reports is an open access publication, and the reason why we established this journal is that there currently is no dedicated journal anywhere in the world for clinicians to make reports about interesting or unexpected or important things that they notice in the care of their individual patients. So we've set up this new journal. We've got a wonderful editorial team. We've got a wonderful peer-reviewed open access process for people to submit their individual cases. And what we're hoping to do is to be flooded with cases. If you think about it, every day, somewhere around the world, there are thousands and thousands of clinicians who are noticing something new and unusual about one of their patients which hasn't ever been reported in the medical literature. Every day around the world, there are grand rounds occurring in major teaching hospitals where young doctors have found things about a patient and they're reporting it to their local community. But a lot of those reports never get into the world literature. So we have the potential to have new discoveries which are happening out there, which we can bring together in a single journal, and which can then inform research which needs to be carried out in important areas of clinical medicine. So I think it's a very exciting phenomenon. The other really exciting part of this open access journal, well, there are many, but another one is that we are creating a database of all the cases. And so researchers will be able to search the database and look at cases of people with similar conditions and see what are the research questions which need to be asked and what are the larger scale studies which need to be carried out for this particular condition. New and emerging diseases, I'd love to have when the next new disease like SARS or avian flu appears in the world, I'd love to have the clinicians who are treating those patients write up the case report so that we can actually sit and look and see what are the different ways in which these diseases have presented, the different ways in which people have been treated, the different ways that people have responded. We know that many new medications which are launched into the general community, it's only when general practitioners have started prescribing these medications to thousands, tens of thousands, hundreds of thousands of people that we start to discover the rare side effects. Now, some of the rare side effects can be very important, some of them can be life-threatening. And so through doctors reporting cases of previously unreported side effects of medications, again we'll be able to build up through our database details of these different cases. So it's a really exciting way of using this whole phenomenon of open access publishing. I think it's also a great opportunity for people who've never published before to do so. Writing a case report, most case reports only need to be short reports, and to describe what it is that you've actually seen and observed and done with your patient. And the most important element of the case report is to tell us about what is the lesson that we need to learn from the patient that you've actually seen. We can also add to the online case report clinical images with the patient's consent, photographs of pathology slides or x-rays or ECGs or video clips of surgery which is taking place or arthroscopies or endoscopies, you name it. It can all go onto the web and then be available as an educational resource to people who are developing up teaching programs in different areas. So there are so many, my mind's sort of working in all different ways. There are so many exciting ways that we're going to be able to use this resource in the future. Well, I'm a committed advocate to open access. I've had the experience where I've submitted a paper and it's been accepted for publication, and because I haven't subscribed to the particular journal where it's been accepted, I haven't been able to access copies of that paper. I also think that we have a duty as researchers to share our findings with the widest possible audience. And in this current millennium, that isn't only other researchers or other clinicians, that's everybody in the world. And we have a major consumer movement occurring in many countries around the world where people are wanting to take more active, direct responsibility for their own health care, are wanting to search the internet for possible answers or explanations about healthcare concerns which they have. What we need is authoritative sources of information. There's a lot of rubbish on the internet, but there's also this wonderful access, if we can assist people to find it, to really high quality, important information which can make a difference to people's lives. So I think what open access gives us is access to our research findings to everybody in the world, and that's a wonderful thing.